Hello, everybody. It's Dr. Young again, and thank you for joining us this week on the weekly webinars, which happen every Thursday from 1 until 1:30. And I have a special guest with us today. I'm really excited about his product. It's Dr. Mark Olcott, and he's going to be introducing himself here in a second. I just wanted to tell you a little bit how I found out about VitusVet. I actually went to a seminar about Facebook, and Dr. Olcott was speaking beforehand about VitusVet, and I thought it was a really good product because, you know, what does happen? So I was even thinking about myself. I'm a vet, but in an emergency situation, do I remember all the information about my dog? She's 14 years old now. There's been, you know, several things that have happened throughout her life. Would I remember that in an emergency situation when I couldn't take care of her myself and I actually had to go to an emergency clinic? If I was out of state, if I was in a different state, in a different environment, really stressed. And so the information that Dr. Olcott shared was phenomenal. And I hope that his product sells worldwide. I think it's really, really fantastic. So I'll just be quiet. I'm actually going to take myself off the camera so that you have more bandwidth and hopefully there won't be any interference. And I'll just hand it over to Dr. Olcott. And if you have any questions, you can just type them into the chat box and we'll take the last 10 minutes or so and talk about the questions that you have. So don't be shy, but just realize that we won't get to your questions until the end. Okay, Dr. Olcott, it's all yours. I'm super excited.
Thank you very much. Well, I appreciate the opportunity and the introduction. Again, my name is Mark Olcott. I am the CEO and co-founder of VitusVet, and I'm also a veterinarian. And what I want to do today is just sort of share with you our vision for the future of veterinary medicine. Excuse me, and see if that resonates with you. Look forward to answering your questions afterwards. A little background about me. I'm originally from upstate New York. I went to college in Western New York. I went to vet school at Cornell. And after 25 years of all the snow, I'd had enough. So I moved down to the Metro DC area where I live now. In fact, I'm joining you today from a really exciting incubator in Baltimore called Betamore. You can see sort of the chalkboard in the back, and there's whiteboards around here, but a lot of really cool, innovative stuff going on. And that's what I think we're trying to do with VitusVet. So let me bring up my screen here for a second here. I'm going to do screen share and bring this over here, present. So hopefully you're all able to see the picture of this dog. And I want to start off today with a story. Actually, the story of VitusVet begins several years ago with a little dog by the name of Bogey. That's not Bogey in the picture there. That dog's name is Sooner, and he's a poodle pointer, and he lives in Wisconsin. But Bogey one day was out for a walk with his owners one Sunday afternoon, and he got attacked by a bigger dog. Kind of came out of nowhere, grabbed him up, shook him. His wounds, thankfully, weren't that bad, but he did have to go to the emergency clinic. His owners took him to the emergency clinic where he needed anesthesia, some minor wound repairs. But unfortunately, rather than having that procedure and going home, Bogey ended up on a ventilator, and he died the next morning. But he didn't die from his wounds. He didn't die from cerebral edema or cardiac failure or anything like that. It's my opinion that he died because his treating veterinarian didn't have a key piece of information that night. You see, Bogey couldn't tolerate a particular anesthetic. He'd had trouble with it during his neuter, but he pulled through okay. But in all the excitement and the drama surrounding the dog fight, his owners didn't remember that. And since this is a Sunday afternoon, his regular clinic was closed. And although that sensitivity was written all over his record at the general practitioner, the emergency vet couldn't access it. And as bad luck would have it, I was Bogey's vet that afternoon. And I remember it like it was yesterday. Anybody who's been in this profession long enough has something like this happen to them. But it's especially frustrating because it really shouldn't be happening in 2015, right? I mean, the reason it's still happening is that there's still too much of this in veterinary medicine. So these are great if you live on a dairy farm, but if you're trying to share information, these silos are terrible. So think of this as a general practitioner, this is an emergency vet, maybe this is a cardiologist. The way we share information in our professions, 30 years out of date. I mean, you think about it, I routinely talk to hospitals who have an MRI machine, but are still faxing records. And that just doesn't add up. There's a lot of limitations to that. So what we're trying to do at VitusVet is free up that information to make it more seamless, to make it easier to share, and also to bring pet owners into this. Because we think there's a tremendous opportunity to transform compliance, to increase client loyalty by making some of this information available to pet owners. So what does our software do? It bolts on to your practice's existing practice management software, and it sits in the background. And it's constantly pulling a copy of medically relevant information in near real time, and it stores a copy of it securely on the cloud. We pull medical notes, so SOAP notes, lab work, patient alerts, vaccine information, prescription information, digital images, all of the medically relevant stuff, all of the information you're probably right now faxing, all of the information that I as an emergency vet would want to see at 2 a.m., right? Because at 2 a.m., when your dog's distemper vaccine is due is irrelevant to me. We don't pull any front desk stuff. There's no billing or pricing or estimates or anything like that. It really is just the medical information. We think there's 3 big benefits, especially for general practitioners. Our software does different things for different types of practices, but today I'm going to focus primarily on the benefits for general practitioners. And so those benefits are, 1, a medical benefit, right? As great as your hospital is, you're probably closed for greater than 50% of the week. And if you really think that all that lab work and the x-rays you take, those diagnostics are valuable, shouldn't your clients be able to access them after hours when they need them the most? So that's sort of a medical benefit of it. That really resonates with pet owners. Because remember, increasingly, pet owners are able to access their own records after hours. VitusVet is really built on a model that's existed in human medicine for over 20 years. They're called personal health records. It's what many university-based healthcare systems have. It's what Kaiser has. It's what the US military has. So this really resonates with pet owners. The second benefit is a way to improve client service. When your clients can see their cat's x-ray on their smartphone, that is cool. And they talk about it, and they talk about it to your friends, and it's 21st century word of mouth. And there's also some pretty substantial financial benefits to this. We deliver all this information to the pet owner through an app that's branded to your practice, where they can not only see the records, but we can also send them push notifications for vaccine reminders. We can do forward booking for dentals. We've got some really cool tools in there for prescription refills and refill requests. I'll talk about that in a little bit. But first and foremost, we think the medical benefit of this is pretty substantial, right? When I was in general practice, I didn't realize how big a problem this was. So as tragic as Bogey's case was, thankfully that doesn't happen very often. But what happens all the time is something like this, where a general practitioner will see a dog for vomiting and diarrhea at noon. They do some lab work, x-rays, decide on outpatient therapy, give some sub-Q fluids, maybe some antiemetics, dog goes home. But he deteriorates. And now it's 10 p.m. on a Friday night and he's in my ER. And what do I have to do? I've got to repeat it all, right? At emergency clinic prices. So nobody's happy with that. And it happens more often than you'd think. So in a 4 DVM practice, that about 2 of your patients every day are seeking after hours care. So it's a big problem and we need to solve it. So what we're doing, one of the advantages of VitusVet is it's not just lab work. It's not just x-rays. We've got everything in one place. So that's sort of an improvement on some of the current portal technology where it's pretty narrow, right? It's not really that relevant. So we have a full DICOM image, soap notes, right? This is what I really want here. So what did you tell the client? So I don't contradict them, right? I'm talking as an emergency vet now. Did you give them a shot of steroids? Great. Which one? How much? So I don't give them some Medicam. Lab work, all the kind of stuff that I think is relevant to patients, clients, the kind of stuff that I'd want to see after hours. It's all in one place. So there's medical benefits. We think there's also some strategic benefits, right? This is a graph that's probably familiar to most of you who are in the quest for A clients, right? And from a former practice owner as myself, I know that these are the clients up here. You know them by name. They spend a lot of money at your hospital. They're really valuable to you, but there's just not that many of them. The B and C clients are the 2/3 of your practice. And the challenge is that what used to be B clients are now turning into C clients, right? And these C clients are not bad people. My guess is there's probably C clients working in your hospital, right? Maybe they have a cat that's not up to date on vaccines. They have a dog who's not current on their heartworm preventative. I mean, heck, I'm a vet. I forget heartworm preventative. So there's a tremendous opportunity here in engaging these clients a little bit better. And you know, one of the reasons that they're slipping is that they're busy, right? There's a lot of distractions. Our clients are out there, they're using Uber, they're buying stuff on Amazon, they're interacting with Facebook. At the same time, mobile search is outstripping desktop search, right? So what's your mobile strategy? How are you engaging clients in the world that they live in? Because if we don't do a better job, if we don't do some year-round engagement with clients so that you're really only effectively spending 15 minutes a year with them, then you start to get this stuff. And many of you may recognize this graph from the Brachy study a couple years ago. But I see these graphs and I see a lack of engagement. I see that 20 minutes in your exam room isn't enough anymore. But if we're able to turn that around and if we're able to, what's it worth then to get your B and C clients just to come in one more time every year, right? To turn this around. And that's not actually that heavy a lift, but you've got to talk to people the way they want to be spoken with in 2015. And that adds up. Right? So for a 4-doctor practice, that's a lot of money. And we think the key to doing this is a branded app that really gives value to your clients, right? This would be your logo right here. These are all my pets. I can request appointments. I can get push notifications for things like vaccines and lab work and dentals. And the key factor here is that people have been spammed to death with email over the last 15 years. And this is a 22% open rate, which means you send 100 emails to your clients, only 22 of them get opened. Push notifications, on the other hand, like the kind you get when you get a Facebook message, those have a 98% open rate. So we're able to really increase compliance by giving them value. We've also built some tools into the reminder that are modeled on the Walgreens app, where we can read your reminder codes. And let's say you sell a client a 6-month supply of heartworm preventative. I know you sold them 6 months. I can remind them to give the pill every month and ask them if they want a refill in 5 months, right? I mean, think about it. Why, after 30 years, the average dog in this country still only gets 3 heartworm pills a year? I think the reason for that is this is a very fragmented profession, and individual practices don't have the resources to build an app like this. So that's kind of what VitusVet is. It's a next generation communications platform where we build tools that you couldn't build for yourself. And this is one of the key parts of that, is maintaining year-round relevance to your clients. And we define compliance very broadly. It's not just for medication. I think this is pretty obvious here. Again, 10 years ago in vet med, the big thing was everybody wants a website. 5 years ago was Facebook. But now people want apps. I know most of you here have a website, and that's great. But what you want to do is, if someone's in the grocery store and they think they need to bring their dog in for a lab work, you want to be able to pull out the app and do it right there. That's just the new reality. It doesn't matter what socioeconomic class your clients are in, what age they're in. My 75-year-old mother uses apps. So it's a differentiator. It's a way to make it easy for your clients to find you, to do business with you. A key piece of that, though, is you have to give value first. So we think that this is really important. And this is just one of the areas. We're in 5 states right now, and we've been growing pretty rapidly because this really resonates with pet owners. These are all pet owners that have downloaded our app in about 5 or 6 weeks. They want the kind of information that VitusVet gives them. Finally, another benefit of VitusVet is nobody likes faxing records. And another financial benefit of this is, let's say, a 4-doctor general practice. You maybe have 2 receptionists on staff at any particular time. This is the number of hours you're open every month. I actually did a survey. Talk to your front desk team, ask them how much of their time they spend faxing and refaxing, and how much time does it take just to write a cover sheet? Creating a PDF sounds easy. In one of the most popular practice management software systems, it takes 19 clicks to make a PDF. That adds up, and their time is clearly better doing something else than just shuffling papers back and forth. So it's really a new way of looking at communication. And I love this quote just because, again, we're really still faxing records in 2015. I think we need to do better than that. That's kind of our message to challenge the profession, that we really need to step up our game. I met my co-founder in business school, and VitusVet actually grew out of a business school project. And one of the big take-home messages of my MBA program was that where consumers are is just exploding when it comes to information technology. And if we want to combat that downward slide and that brachygraph, we need to do a better job. We need to step up our game and engage with them better. There's other providers in this space. We think we've got some pretty significant advantages. Number one, there's an app that's branded to your practice. It's got the full medical record. Some of these other providers have vaccine access, some prescriptions. Petly is an IDEX product that makes lab work a little bit more available, although it doesn't really work after hours because it has to be shared by somebody. So again, it doesn't help me as an emergency vet after hours. If your office is closed, I'm out of luck. So it's really just sort of a different way of looking at things. And the pricing is pretty simple for the vast majority of private practices. This is about $100 a month. We think there's easily a 10x return on investment with this. And probably the most important phrase on this slide is right up here. It's a monthly subscription, right? If you don't like it, we'll turn it off, right? I mean, no one's turned it off yet. And this has been live for about 2 years. And we really think it's a pretty strong value. With that, I think I'm running up toward the end of my presentation. With that, I'm happy. These are some of the hospitals nationwide that we're working with. And with that, I'm happy to answer any questions. And I'll turn it back over to you, Dr. Young.
Yep. So I don't see any questions yet in the chat box. Okay. But what I really love, and what I actually want to address also, is the fact that you share the information with the owners. And I'm going to see if I can share my turn my camera back on again. It allows you to share the pet's information with the owner. And I know in veterinary medicine, with those silos that you had up there, we're so worried that, oh my gosh, we're going to lose a client. If they have this information, they might go someplace else, and that doctor might tell them something else. Sometimes you have those clients who just go through doctors and they just want to find the one that's going to tell them what they want to hear. But I really like the fact that it's all about the engagement. And I think that's where a lot of us go wrong. We don't allow the engagement of the client.
Yeah.
It's one thing when you have them in your exam room and you basically feed them information with a shovel and they just stand there listening to you. And some of them may have some questions for you, but really the questions come once they're at home. And then they pick up the phone, they want to talk to you, and you're on to the next client. You're in surgery. You don't have time to call them back until after hours, and then it's 8 o'clock, 9 o'clock at night, and you're wondering if you can still call them back, or
and then they use Dr. Google.
Exactly. And then you've lost that engagement. Yep. And yep. That's why they seek somebody else, not because they don't trust you. It's because they don't have that engagement that they need when they have questions. And so I love that.
There's a lot of power in transparency. You're exactly right. Remember, we're not showing them anything they're not legally entitled to. Any one of your clients could call you up today, right now, and they could see all this. So again, they're legally entitled to this, or legally entitled to a copy of it. And certainly it's a different level of transparency, there's no question. But that's very powerful. And that's sort of one of our messages, is that by extending this to them, it turns pet owners from clients into evangelists. I mean, they really like this. So that's something that I think is really powerful. And I anticipated when we started this that some veterinarians would be worried that, wow, if I make all this information available to my clients, they're just going to switch vets. And I have two counterpoints to that. One, they can already switch, right? The record is not anchoring them to your practice. You don't own your clients. They can switch tomorrow. They call up a competitor and say, hey, I want to switch. My old vet is Main Street Veterinary Clinic. And they don't have to call you and have that uncomfortable conversation. The new veterinarian would be happy to do that. So switching vets is already relatively frictionless. But more importantly, I asked 50 pet owners when we first started VitusVet. I said, if I gave you full access to your medical records on an app like this, would that make you more likely to switch vets? All 50 of them said, no, if you gave me access to my records, it'd make me more loyal to you. So that's one of the lessons of the internet age that I think veterinarians need to understand a little bit better, to get away from this concept that, you know, your clients are yours and that you own them. And there's a lot of power in transparency.
Yep, absolutely. And I think that the new generation of veterinarians, the new graduates that are coming through the school system, I think compared to, you know, our generation, I think they share because they're so used to the phones and the apps and the internet. I think they are more used to sharing, and I also see them being more positive than we are. That has nothing to do with VitusVet, but I just noticed that the other day that they're more about positive reinforcement than some of the negative reinforcement that we were taught or we picked up. So the fact that I love that picture where the girl was sitting, or the lady was sitting on the floor, you know, and it's just, we have our phones on us. It's when you don't have your phone on, you feel like you're not complete. You know, half of your life, my phone's right here, half of my life is in my phone. And so why shouldn't the information about my animal be readily accessible to me? It would just make me feel better.
Also that's a great point, because remember, it's different than in human medicine, right? In human medicine, there's sort of this third party other that's paying for my care. I mean, I know I do indirectly, but in veterinary medicine, when I write that check or pay with a credit card, when I see the green go out of my pocket, I have a much different set of expectations for that service provider. So increasingly, clients are saying things like, you know, if I can talk to one of my clients or one of my friends in Australia on FaceTime in near real time, why can't I see my dog's x-ray? You know, don't tell me it's not possible. I know it's possible. Why aren't you showing it to me? So that's the opportunity that we have there. And it's just sort of a different vision. You know, in the past, information was power. And whoever had information had all the power. But now information's everywhere. It's ubiquitous. And our belief is that the people who are going to be the most successful in the future are the ones who are best able to share information and not hoard it. So that's just sort of how we believe. And to your point about new graduates, you're right. There's two groups of people. When I describe what we're doing, they get it immediately. One is pet owners, and the other is veterinary students or new graduates, right? They're digital natives, the ones who grew up with this technology. So you're exactly right. They get it.
Yep, absolutely. So what are the big questions that you get from veterinary clinics? What are some of the big ones that you hear over and over again when you present this product to them?
Yeah, so the general practitioners are everybody is wondering about who can see what and when. And I'm glad you asked that question, because we actually have built in a number of different types of controls into this. So for example, we would pull a copy of a lab test, for example. And if another veterinarian logged in to this particular patient's account, they could see that lab work almost immediately. So if you did lab work at noon and I'm the ER vet that's seeing that dog at 10 p.m., I could see that lab work. But the pet owner can't see it for 5 days. So the last thing we want is for a pet owner to read a histopath report and not understand it and flip out, right? So there's a lot of rules over, again, who can see what and when. That's just something that's really important. There's a number of different levels, a number of different tools that we have to control that. So that's probably the biggest source of question is we're trying to provide smart transparency. We're not showing everything at all. There are ways that you can hide information so that the clients, stuff that are maybe internal notes that are not relevant, that you wouldn't want another veterinarian seeing, that's fine. But again, we come back to what would an emergency vet want to see at 2 a.m.? That's the kind of information we want up there. We're not looking to make anybody look bad. In fact, the feedback from pet owners is overwhelmingly positive. They really like this.
Mm-hmm. So is there, how do I word that? So say if I didn't want my clients to see the histopath results for 10 days, is there stuff that you can, how do you say that, like personally design it so that, say, for instance, the default is every 5 days, but I want it to be 10 days. Or is it just whatever it is, that's what it is?
No, it's very, for lab work, it's 5 days. But for notes and so forth, soap notes, communications, anything like that, there's a couple of different tools that we have where you can control it infinitely, or you can shield it permanently. So okay. yeah, there's a lot of different ways where it's you
so I have some input into
absolutely.
It, not just
absolutely.
Okay, that's great. So have you had any vet clinics who have tried it and then said, no, this isn't for me? And if so, why?
No, not yet.
Okay.
I think that we're just starting to expand outside the area. We have sort of a whole different presentation is how this works for emergency and specialty clinics, because we do some pretty interesting things for them too. We automate all their outbound record sharing and allow referring veterinarians to be able to access information on their patients while they're in the hospital. So they can log in and read lab work and x-rays on their patients. So there's sort of two very different use case scenarios, but no, so far we haven't had any churn.
Excellent.
I'm sure it'll happen, but so far so good.
Right, it always happens, doesn't it?
Yeah.
But yeah, excellent. Well, I think that's about the end of our time, and I'm checking there's nobody who's put in any questions.
Great.
But what I'm going to do is, if it's okay with you, I will just put your email address in the chat box so that people have it.
Yep.
And then if they have questions or they want to have you come into their clinic to present the material to their teams, or they want to get in touch with you, I will just forward information to you if that is okay.
Perfect. Yeah, I appreciate it. Thank you very much.
Excellent. Oh, hang on. Okay, so the question is, how does this differ from programs like ePet Health, except being mobile and not email?
Yeah, well, those are two pretty big exceptions. The mobile fact is a huge piece of this. I would say, more robust access is the big thing. So ePet Health is another sort of portal program that allows clients to get some access. It's kind of cumbersome. They've been in a couple of different hospitals where, or we've displaced them from a couple of different hospitals. The app is a real big piece of that, because when you ask a pet owner to remember their ID number or something to access a portal, they just don't do that. They want it here. So I can't stress enough, the mobile piece is very important here, and as is the year-round engagement. So we do some other really interesting things to try and keep clients engaged with your brand year-round. But yeah, that is ePet Health is a similar program, but you know, it's I think ours is more robust.
Yep, just one step ahead.
Yeah.
Gotcha. Yep, excellent. So I don't see any more questions. If I get more questions, because I did turn that feature on this webinar, I will forward them to you. And then this will also be on YouTube, and I'll probably put it out on my email next week, just because I think it's a wonderful product, and I think it's going to help a lot of pets and a lot of pet owners and a lot of doctors, a lot of veterinarians.
Yeah, that's our goal. Thank you very much.
Excellent. Thank you so much.
All right. Bye-bye now.
Yep. Bye-bye.